As India witnesses a spike in COVID cases with 1,134 freshly reported cases, Prime Minister Modi has taken swift action and chaired a high-level meeting to discuss the issue of rising cases. During the high-level review meeting on COVID and influenza situation in the country, the Prime Minister emphasized on COVID-appropriate behavior, including wearing masks in hospitals by patients, health professionals and health workers as well. So COVID cases on the rise again. There's a new virus, a new mutation, which is being of a regular concern for the government, and to make sure that all precautions are taken across the nation, the Prime Minister chaired a high-level meeting. Arzu, my colleague, joins us on the phone line to talk more about this. Arzu, growing COVID cases across the country is definitely a cause of concern. The central government is taking cognizance of this. What about the states?
Well, the Prime Minister Narendra Modi yesterday held a meeting, high-level meeting, to review the COVID situation amid the rise in the cases in the country, also in the state. If we particularly talk about the Delhi, in Delhi also more than 80 cases is being recorded. So this is and also the influenza H3N2 is also making people sick. So the central government is also taking a step, and they advise the state government to follow the previous formula, that triple T, test, track and treat. So the advice is being given to do the same, and also to follow the proper COVID-19 behavior, to wear masks. Also advise in the hospital, the workers, the doctors and the patients should always wear masks while moving ahead. So it is advised to wear mask and follow the proper COVID-19 guidelines. So this is all being done, and India has recorded 1,134 new COVID-19 cases, while the active cases increased to 7,026. According to the Union Ministry, this data was given. So the numbers have been increased, and keeping that in mind, the Prime Minister Narendra Modi himself chaired the high-level meeting and advised the state governments to not lose the attention on this issue and keep working on it, and also follow the same formula which was being done to tackle the COVID-19 worst situation. So the test, track and treat formula will again be seen in the states, and also if we particularly talk about the national capital, the things have also decked up in the airports. Also the sudden testing is being done, so that the cases which are increasing can be settled down, can be decreased in the following years, in the coming time.
Right, and Arzu, also important to understand, what is the health ministry saying at this point in time in terms of prevention and caution when it comes to this new mutation?
Well, it is said to wear mask, and the minister is also saying that there is no need to worry, as the AIMS doctor is also saying that the cases might be increasing, but there is no such risk of any in the coming time that the cases will go so high and it will increase the hospitality rate. So there is no need to panic and worry about the COVID-19 cases as it is increasing. Just take some precautions like wear mask and use the sanitizer, and this is just said, and there is no need to worry about the rising cases of COVID-19.
Arzu, thanks for that. Dr. Ishwar Gilada, health expert, also joins us on the show to give us the thoughts on this new worry. Dr. Gilada, very good morning to you. Should the nation be worried about these rising cases, and what kind of a mutation now are we looking at?
See, currently, understand one thing, that for last 15 months, there has not been a single new variant. So after Omicron, and Omicron has been a very supportive to India. Whatever small mutations are there, we should not be worried at all. What we are seeing is the XBB 1.16. Our country is having XBB for last almost 6-7 months. So whether XBB is 1 or 1.16 or 1.21, it doesn't matter. What is matter currently is cases are rising, and they are rising exponentially as compared to about 1 month before. So in last 3 or 4 weeks, it has been 6 times jump in number of cases. We are reporting only 100 cases a day earlier. Now we are reporting almost 700 to 1,000 cases a day. But there is no uptick in hospitalization, oxygen demand, ICU, ventilator, and deaths. Deaths are proportionately in the same range. But all these deaths are only in the elderly population, those which are with the comorbidities. The problem is there is a waning immunity, whether immunity is to the natural infection or immunity to the vaccine. A lot of people have not taken the third dose, and second dose has been taken almost 1.5 years, 2 years before. Third dose who have taken, they have taken 1 year before. So under this situation, we should look after those people which have been above 60 with comorbidities and not taken the vaccine. We do not need mask mandate immediately. We can request mask for those people which are coughing and having running nose. As soon as they find first symptom, they should use mask. And protect those people which are at home, because young people, children, they will be conduit from society to take the infection to their family members which are elderly at home.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.